Hey friends, good morning. This is Imankan. Welcome back in Pharma study. Please subscribe this channel for more interesting videos. Today's topic is what is osteoarthritis. So let's start now. Osteoarthritis, commonly known as wear and tear arthritis. It is the most common type of arthritis. It is associated with a breakdown of cartilage in joints and can occur in almost any joint in the body. It commonly occurs in the weight-bearing joint of hips, knees, and spine. And here is major joint of the human body where arthritis may be affected. First is spine, second is knees, foot, hand and hips. They are joint where osteoarthritis maybe can develop more. And the other definition of osteoarthritis also called OA, is the most common chronic condition of joints affected approximately 27 million Americans. Osteoarthritis can affect any joint, but it can most often in knees, hips, lower back and neck. Small joints of the fingers and the bases of the thumb are big toes. In normal joints, a firm rubbery material called cartilage cover end of each bone. Cartilage previous uh, Cartilage provides a smooth gliding surface for joint motion and act as a cushion between bones. In osteoarthritis, cartilage break down, causing pain, swelling, problem of moving of the joint. And what is the osteoarthritis basics and the joints and its parts? So, joints are designed for to allow movement between the bone and to absorb shock from movement like walking or repetitive motions. These movable joints are made up of following parts. That is, first one is cartilage. Cartilage, a hard but slippery coating on of the end of each bone. Cartilage break down and wear away in osteoarthritis. Second is joint capsule, a tough membrane sac that encloses all the bone and other joint parts. Third is synovium, a thin membrane inside the joint capsule that secretes synovial fluids. This is called synovium. The synovial fluid. What is the synovial fluid? A fluid that lubricates the joint and keep the cartilage smooth and healthy, called synovial fluid. And last one is, next is the ligaments, tissues that surround the bone and joints and allow the joints to bend and move. Ligaments are tough, cord-like tissues that connect one bone to another. Tendons, tough fibrous and ligaments, tissues that surround the bones and joints and allow the joint to bend and move. Ligaments are tough cord-like tissues that connect one bone to another bone. Tendons, tough fibrous cord that connect muscles to bone. Muscles are bundles of specialized cells that, when stimulated by nerves, either relax or contract to produce movement. And now we will discuss steps one by one. First is, what is cartilage? Cartilage is a tough but flexible tissue that is the main type of connective tissue in the body. Around 65 to 80% of cartilage is water, although that decreases in older people, and the rest is a gel-like substance called the matrix that gives it its form and function. The matrix is highly organized and consists of several types of specialist protein called collagen, proteoglycans, and non-collagenous protein. And now this is the cartilage tissue. This is the image of cartilage tissue. This is a microscopical image. And there's a lacuna, and there's a chondrocyte. This part is called chondrocyte, and this pinkish part called extracellular substance. And this is the human body structure, and the red spot called the parts where cartilage found in human body. This is a pinna, like larynx, shoulder, respiratory, elbows. This is all part is here, which is found cartilage tissue. There are three main type of cartilage. hyaline, elastic, and fibrous. They have different properties that correspond to their specific functions in the body and make it is the most appropriate type of cartilage at that particular site. What is hyaline? Hyaline, or also called articular cartilage, is found in the joints septums of the nose, which separates the nostril and the trachea or air tube. Elastic cartilage, which has elastic fibers that make the cartilage more flexible, is found in the ear, part of the nose, and the trachea. And fibrous cartilage occurs in special cartilage pad called messines that helps to disperse body weight and reduce friction, such as in the knees. And in the joints, hyaline cartilage form a very low friction 2 to 4 mm thick layer that coat the bony surfaces. This allows the bones of the joint to glide over one another during movement and ideally last a lifetime. It also serves as a cushion and shock absorber in the joint. And the articular cartilage matrix is produced and maintained by a group of cartilage cells inside the matrix known as a chondrocyte, also shown in cartilage tissue images. And these come from a mass of connective tissue in the embryo called the mesenchyme. And the volume of cells in the cartilage is small, making up about 1 to 2 of the tissue's volume in the adults. Cartilage contains no blood vessels, no nerves, and no lymphatic system. Nutrients have to diffuse through the matrix. So no directly blood flow in the cartilage. Then now is what is synovial fluid. Synovial fluid is produced in the space between certain joints to help reduce friction and facilitate movement. Between articular cartilage, certain disorders that cause inflammation of the synovial fluid cause severe pain and limited movement in the affected joints. Common conditions include rheumatoid arthritis, psoriatic arthritis, reactive arthritis, and GORS, among others. And there is a picture of synovial fluid. This is the bone. This is the two bone of the knee, and this is the end of the bone, and after end of the bone, this is called as the cartilage. The both end of the bone called cartilage. This is called cartilage, and this is a area filled by a fluid. This fluid also called synovial fluid. And for a kind of information, this is blood. And now synovial fluid is in the joint capsule has four important functions. First one is it keeps the bones slightly apart, protecting their cartilage covering from wear and tear. And also it absorbs shock, again protecting the cartilage. And third is it lubricates the joint, helping it to work freely and easily. And fourth work is it acts as a filter, letting nutrients reach the cartilage but blocking the passage of harmful cells and substances. And the most important component of the synovial fluid is a substance called sodium hyaluronate. Is this substances that let synovial fluid perform its four different functions all at the same time. Most of the joints in your body are synovial joints. Good example besides the knees include the hips and the shoulder. And now what is the ligament? Ligament are bands of tough elastic tissues around the joint. They connect bone to bone, give your joint support and limit their movement. You have ligaments around your knee, ankle, elbow, shoulder and other joints. Stretching or tearing them can make your joint unstable. And this is the picture of ligaments. There is your knee joint, and this is the one bone, this is the another bone, and this is the joint called ligament. They have two ligament found in your knee joint. First one is this side and second one is this side. So now what is tendon? Tendons are the connective tissue that transmit to mechanical force of muscles contraction to the bones. The tendon is firmly connected to muscle fiber at one end to and another end. At its other end, tendons are remarkably strong, having one of the highest tensile strengths found among soft tissues. Their great strength, which is necessary for withstanding the stress generated by muscular contraction, it attribute to the hierarchical structure, parallel orientation, and tissues composition of the tendon fibers. And this is the image of tendons. This is the bone. This is the bone, yellowish, and this is the reddish in muscle, and the this is called tendon, or this is called tendon. Tendon, one part of the tendon join with the muscle, and the second end part of the tendon joined with bone. So this is the structure of tendon. And now, cause of osteoarthritis and the risk factors. What is the different type of risk factors? So first one is age. People above the age of 45 have a risk of for developing osteoarthritis. It is, however, most commonly found in the people over age of 65. And second is gender. This disease is osteoarthritis commonly in women, particularly after the age of 55. Third is obesity. This can be one of the cause of osteoarthritis, as every kilogram put 3 extra kilogram of the pressure on the knees. And fourth is heredity. Genes that are responsible for creating and maintaining cartilage might have a link with osteoarthritis. Fourth is injury. Fracture through joint or ligament tear may be osteoarthritis. Sixth is overuse of joints. Repetitive use and injury in the sport or occupation increase the risk of osteoarthritis. And last is weakness and muscles. Weakness of muscles. Weak thigh muscles lead to osteoarthritis, knee joints pain. So this is all about osteoarthritis. Please subscribe this channel for more interesting videos. Thank you. Bye bye.